questions to clarify. So I know CDC has partnered with a private manufacturer to make test kits available, and the amount of kits is it's increasing exponentially. It's happening now. That being said, I find it interesting that when my colleagues who were in contact with someone who later tested positive were able to get tested almost immediately and quickly receive their results, while folks in my district and across Washington State are unable to get their testing results back. So I do find that people are now getting tested. I was on the phone with one of my local public health agencies yesterday. But what I'm being told is, so we're trying to get people into the University of Washington, right? But people who go locally, they get and it goes to the state lab, there's still a delay. I mean, we've been waiting for about 5 tests for a number of days. Like every day, the headline is still waiting for the test results. Could you quickly speak to that?
Great question, and it's why I hope in the time I get, I accomplish what I want in building core capability. These public health labs need redundancy. They don't have it. This is when I go back about the core capability of data, lab, people, rapid response fund, and global health. The truth is we've not invested, we've underinvested in the public health labs.
There aren't enough people to
There's
run
not
the
enough
test?
equipment, there's not enough people, there's not enough internal capacity, there's no surge capacity.
So we're being told that they also, so even the UW, so UW can process about 1,000 a day, and there's capacity there if the clinicians will send it there versus public health. But does UW then also still have to be validated by the state? Because we're being told that.
All UW, which they've done, had to do is on the 29th when the regulatory relief was done, and they are CLIA approved lab, they just had to develop their own test. They didn't have to use CDC's. We've published exactly how to do it, so anybody can replicate it. And all they have to do is run to make sure their controls work. They don't have to send it to us. They don't send it to the FDA.
Completely decoupled then.
They go. In 15 days, they have to file to the FDA, okay? But I want to say one thing about that, why it's important. Why are they different? The public health labs, we built the technology in those labs to monitor flu. That uses a certain equipment, which we call a thermocycler, right? That equipment, maybe a good lab could do 300 tests a day. University of Washington can use these high throughput machines like New York is about to do. Those machines can do thousands and thousands and thousands. And so they are converting to those high throughputs, but the public health systems never had the equipment to do the high throughput.
I apologize. I have to reclaim because we don't have a lot of time left. So there is a lab in my district, so I'm grateful that Quest and LabCorp are coming online. That's important. I have a lab in my district who has worked with CDC on HIV well, and they have found it impossible to get in contact with CDC on COVID-19 testing. And due to the fact they weren't able to get samples back from CDC, they had to resort to getting their RNA samples from Israel. Now, I know they're a smaller, and UW actually in the beginning days had some of this challenge. They had to develop basically their own tests, like they went through it all themselves. And I know that the administration has been working with the big guys to get them going for capacity purposes. I would be grateful if they could also be responsive to some of the smaller guys, because in the rural areas, we just need more people. And if these labs are willing to do it, go ahead.
Congresswoman, if you give me the specifics, I'm happy to look into it.
I will do that. I will do that. The one last question I had, and sorry, I'm breezing through this, has to do with nursing home guidance. I know that Seema Verma has been, and the administration has a new focus on enforced protocols, right? Had people been following protocols, we'd be in a better place today. However, what I'm hearing at the ground level is, yes, things go up on a website, but my local public health said, I don't have the capacity to go into every single home and make sure everybody's doing, I'm paraphrasing. How can we help make sure that the nursing homes in our communities right now today are getting the information and are at least communicating about what they're going to need or what they will need? And how can you help with that?
Well, we've put together specific guidance, and we will continue to try to make sure. I know SEMA and CMS is going to be aggressively making sure each of the nursing homes are up, because this is our vulnerability. When you see tragically the 27 people that we've lost, and I think 23 of them have been in your state, and many of them had been in that nursing home. So this is really a priority to get that up and running, infection control up and running, provide the technical assistance. This is our #1 vulnerability right now.
Thank you.